Darren Peterson out here, just enjoying a beautiful day. Wow, it's gorgeous. How are you, Darren?
I'm good. Looking forward to my procedure tomorrow.
Getting excited for your first major hair transplant with one of the top doctors in the world?
Charles is going to hook it up. He's going to make me look 20 years younger.
Hey, good morning, Darren. How are you?
Hey, Dr. Charles.
Good to see you again. Come on and have a seat here. We're going to talk about what we're going to do today. We're going to kind of go over our game plan again. Now, as far as the back is concerned, that's pretty self-explanatory. We're going to fill in the spot, and we are going to work forward here into this area that's starting to thin.
Okay.
So we're going to definitely hit all these areas. What we need to kind of talk about is the hairline. As we talked about in the consultation the last time you were here, I think that this height is adequate. I think this is where it should be. This is where I put it even if you didn't have a hairline. So I don't think we should mess with the front center area. Your issues that we can address are the lateral portions of your hairline and the temporal. So again, we're just going to move this all forward just a little bit. Okay. We're just going to push the corners forward. Mm-hmm. Same angle, just push it forward. Okay. That way it stays. Most important thing is the natural appearance. Okay. So you always want to make sure you're maintaining a natural appearance. And I think your issues are more in the corners. Just your corners have crept back. We're just going to push the corner back.
Got it.
Darren's here today, and he's having what we call an FUT procedure, which stands for follicular unit transplantation. That's one of the two main types of surgeries that we offer, and the other one's called FUE, follicular unit excision. For Darren, he didn't want to shave his head, and he wanted to have more of a camouflage look right off the bat, so we decided to go with FUT. And we're going to be doing somewhere between 2,500 and 3,000 grafts today. We don't have our exact counts yet because we're still in the process, but I would say it's between a medium and a large case for us. The first one, this green capsule here, is an antibiotic, okay? And I'm going to give you instructions to how to take the rest of them after you leave here today. And the two yellow ones will help you relax. They just take the edge off a little bit, and so you can relax and sit in that chair for 4 or 5 hours without getting restless, and lowers your anxiety a little bit. So you can take those now. You can take that one at a time or all together, however you can get that down. And then we're going to go back into the surgery room, and we're going to start prepping you for the surgery, and I'll walk you through how we're going to do the anesthesia and all that too, okay?
All right, perfect.
I think back in the infancy of hair transplantation, the future wasn't really thought about so much. It was more like, let's try and see what we can do right now for this person, but they didn't really think about what's going to happen if some additional changes happen with this patient over time. So then what may have looked good initially, as the patient got older and lost more hair, all of a sudden didn't look good anymore, and they didn't have a lot of options at that point. So now we're kind of looking at the patient from a different perspective. Not only in the immediate term, trying to make an improvement, but we also talk about prevention of further hair loss. We offer many different modalities to treat the hair transplants and hair restoration surgery. There's just a lot more options available. And personally, I like to have as many of the options available as I can, because I think that allows me to treat a wider variety of patients. Okay, so we're going to get ready to start the anesthesia. Okay, so I'm going to have you hold on to these right here, one in each hand.
Okay.
And what I'm going to do, Darren, is I'm going to start with the anesthesia in the right corner. So you're going to feel a little stick, a little burn right behind your right ear. Mm-hmm. I'm going to slowly work my way across the left ear.
Okay.
I do a little bit, and then I take a little break. And I do a little more, and then I take another little break. Okay? So I know you're going to kind of clench up when I'm doing it.
Yeah.
When I take my little break, take a deep breath, relax your hands, and relax your body. Okay? You got to kind of relax in between. And we're going to get you through this as quickly and easily as possible. Most people are scared of surgery, and they're scared of pain. Hair restoration surgery is really scaled on the lower level of surgery. It's really minor surgery. It's outpatient. It's all done under local anesthetic. I tell patients the truth. Look, in the first 5 or 10 minutes, we have to do local anesthetic. There's really no way around that. I really don't think that hair restoration is worth going under general anesthesia for. There's a lot of risks involved with that. And not only the risk, but a lot of expense. So you're talking about local anesthetic, something very similar to what they use when you go to the dentist. Very minimal. People get through it. We have a lot of little tricks that we do to kind of trick the nerve and disguise the pain. We get people through it really easy. And then the rest of the surgery is pretty much a cakewalk. Now, admittedly, that afternoon, that evening, when the anesthetic wears off, there's a little discomfort. We give you some pain meds. We give you a way to kind of stay ahead of the pain so it really never catches up with you. And you get through the first couple of days, and you've got to be looking at the bigger picture as once you have all that hair, you're not going to even remember that little bit of pain you had for a few minutes. I finished making the incisions in the front corners. This is the left frontal temporal area here. Just made some brought the lateral hairline down just a little bit, strengthened it, and just brought his corner a little forward. And same thing with the other side here. See, brought this forward here. Same thing as the other side. And now we're starting in the back, and we're going to start making some tiny recipient sites in this back area. Try to give them some density back here. I think that people think there's a rise of the incidence of hair loss in young men. I really don't think there is. I think it's the same as it was before. I just think that it's more common now, and people are coming out now, so that's why more people are being noticed with it, more people are getting treatments for it. I don't really think there's a higher incidence of hair loss. I think it's probably the same as it always was. And there's so much knowledge now, and we can diagnose things, we can try and predict things, and we have more ways to treat patients, more options. So I think that more people are going to be doing hair restoration in general. These ones up here, up front here, are single hair grafts. These have 2 hairs or 2 follicles. These have 3 follicles. In the front corners, we're only going to use mainly ones and maybe a few two hair follicular units. And in the crown, we're going to use mainly 2 and 3 hair follicular units. You know, often when I'm seeing patients, they kind of want to know, they're maybe looking at other clinics, and I never discourage a patient from looking around and getting second or third opinions. I think it's a good idea. But then one of their common questions is, what makes your clinic different from another clinic? My answer to that is I just think that the personal touch that we have here and the quality of work. I personally take a lot of pride in what I do. In fact, I would have to say I'm a little bit obsessive compulsive about every little detail, but usually when it comes to the patient, they don't mind when I'm a little OCD when it comes to their hair. But little things can make a difference, just the way they're treated in the office when they get here. I call patients personally myself at home the evening after the surgery, so they get to hear from the doctor. Not one of the nurses, not one of the technicians. I call them myself. They have my cell phone number. I'm always available. Unfortunately, I think a lot of clinics that once the patients had surgery there, they just basically become another number, and they're pretty much forgotten about unless the patient contacts them. So we reach out, we try and follow up, we make sure on a regular basis that the patient's on the proper path, and we make sure that they're comfortable and happy with everything that's happened so far. So those are just some of the things I think that make us a little bit different than most clinics out there.
How many hours was it?
Oh gosh, 4, 5, 6 hours? 5 to 6 hours? Feel great. Didn't even get to finish my entire Netflix series, so.
He looks great.
Yeah, they say I look good, so that's what it's all about. Look good and pain-free right now.
Come on back, Darren.
Oh, have a good one.
Hey, thank you. Thank you so much.
All right.
All right, Darren, come on in here. We're just going to do a couple quick photos.
Okay.
This one's a little easier because the hair doesn't fall over. Okay, we're going to spin the chair around. I'm going to touch your head back a little bit. So, Darren, we did 2,612 grafts.
2612.
Yeah.
Okay.
Stay right there.
If I had to guess, 2,000 in the back. Maybe 600.
Would you say is that quite a few?
Yeah, it is quite a few, but it's a big spot.
Yeah.
So is that ever going to be as thick as it was when you were a kid? No.
Yeah.
Can't do that with single surgery.
Right.
Maybe you have some coverage better than you had now. Yeah, because you don't have anything there now, so you're going to have quite a bit more.
Wait, let me just get this shot because I like to
donor?
see that you can't even see it. Like,
Yeah, okay. Then what I'll do also is I'll just to show that there is actually sutures under there. You took an antibiotic this morning, green capsule. There were 6 in the bottle, now there's 5 because you took one. You're going to take one tonight, and there's going to be 4 left. Morning and night on Tuesday, morning and night on Wednesday.
Okay.
Okay, that. Pain. If you're going to have any pain, it's going to be donor pain.
Right.
Stitches.
Right.
That's it. And this afternoon, as the anesthetic starts to wear off, you're going to get some discomfort back there, but probably more so at night when you try to go to bed and lay down on it.
Okay.
So I want you to try and stay one step ahead of the pain. Don't wait and see how far you can go without taking anything. We're not trying to see if you're a hero or not. Sure. Okay, so you're better off kind of dealing with the pain right away, the first line of defense is 3 extra strength Tylenols. Those are 500 milligrams each, so it's 1,500 altogether. You can do that every 4 or 5 hours. I am giving a prescription for something stronger that you have to stop at the pharmacy and have this. Try and save the stronger stuff for bedtime.
Okay.
Okay? It's a little stronger and it causes drowsiness, so it helps you sleep.
Gotcha.
If you take the stronger pain medicine, you cannot drive the car. The only other rule besides no driving is you have to have food in your stomach. So somehow tonight you made it to bed and you really didn't need it because the Tylenol was doing the job. But then you wake up at 3 o'clock in the morning and it's really throbbing and you're thinking, geez, I better take one of the stronger ones. You still have to eat something.
Oh,
A
okay.
bagel, a peanut butter sandwich, something.
Okay.
Okay, so maybe, are you staying in a hotel or are you staying, where are you staying tonight?
Yeah, I'm staying with Jeffrey and Sunny
Hotel?
Isles.
Is it
Sunny
Is
Isles.
it a hotel or is it a condo?
It's a condo.
Okay, so he's got food there.
Yeah.
Okay, good. So
Yeah.
you're all set then. Okay. That takes care of all the medications. You got to take it easy for about a week as far as any exercise or activity is concerned.
Okay.
After 1 week, you can start doing some light exercise. After 2 weeks, there's no restrictions. The one motion you want to avoid, to try and minimize the width of the scar in the donor area, you really want to avoid trying to purposely, reach down and touch your chin to your chest. And I know a lot of people do this after about a week. They want to test out the range of motion of their neck to see if there's still pain where the stitches were. All you're doing is just stretching it out. I do not expect you to walk around like you broke your neck. Okay? And you can look down and do a text or go on your computer. That's normal flexion. This is not normal flexion. That's hyperflexion.
Right.
Don't do it.
Okay.
When you start working out again, be careful on any benching, stressing, or those type of sit-ups where you're crunching and pulling your chin to your chest. There's plenty of other ways to do abs. Okay? I mean, I'm a workoutaholic, and I know there's a million different ways to do things. Just avoid chin to chest
Gotcha.
for like at least a month.
A month. Okay.
Yep. Okay. On your top pillow tonight, as a courtesy to your friend, because you're staying at your friend's place, lay this pad down on your top pillow.
Okay.
You could potentially get a little bit of oozing the first night only. So if you wake up in the morning where the stitches were hitting this little pad on your 2 pillows that I want you to sleep on, just 2 pillows, don't panic. It's normal the first night. And you can throw this pad out tomorrow because it only happens the first night.
Okay.
Okay?
And what is it that's oozing? Is it
The stitches.
blood?
The
Is it
stitches.
blood?
Yeah, sometimes if you have a crust on there and you move around and it knocks the crust off, it can start to ooze a little bit
Okay.
again. It's like having a shaving cut and taking that Kleenex off
Yeah.
and it starts to ooze again.
Okay.
If you have any bleeding from a graft, from either of these 2 corners or the back where the grafts are, it would be before you went to bed today, only. So I'm going to give you a stack of gauze. If you have any bleeding, because periodically you're going to check, or Jeff's going to peek at your head and say, everything was good. If you have any bleeding, do not panic. These are tiny wounds. They're like a paper cut, literally.
Yeah.
You're going to take 1 piece of gauze. You're going to fold it up in half. You're going to fold it in half again. And you're going to put a couple drops of water on it just so it's a little bit damp. And with 1 finger, you're going to hold gentle pressure on the spot, here or here. About as hard as you'd push on a shaving cut. These wounds are really shallow. If you push too hard, you're actually going to push grafts out of their
Gotcha.
hole.
Gotcha.
They're so shallow that the weight of your finger is plenty. Just make sure the gauze is a little bit damp so that the blood, if there's blood on it, doesn't dry onto the piece of gauze. And when you pull the gauze off, you don't pull the graft out with it.
Right.
If it's damp, it won't stick.
Okay.
A lot of things I love about this field of hair restoration surgery, and it's the most important thing is actually, seeing the smile on people's faces and making them happy. But I tell you, I mean, over all the years and all the people I've met, I've made some incredible friends, and it's the relationships you build with patients and the ongoing situations that you have with patients and staff and my colleagues. I travel around the world to learn about hair restoration surgery, and I have doctor friends that do hair restoration surgery from Israel and Brazil and all these other countries, and we see each other every year, and we have amazing times together, and we talk about things, and we talk about how we can help patients, and we listen to what other doctors are saying, and they have some incredible ideas. There's some really smart people around this world, and it's amazing to be able to just try and bring that home and incorporate it into your surgery, even if it's not the exact same thing, maybe portions of it, and we tweak things, and we're just trying to make things better all the time and get better results for patients. That's really what we're all trying to do.